Hello and welcome to SRG Medicine. Today, in this video of Respiratory Series, we shall continue our journey towards understanding cough. So the contents of this video are types of cough, your very own personal clinical skill box, general tips, and concluding with summary. So here, I would like to remind you that we shall be dividing cough on different bases. So starting on with our first basis based on duration. So based on duration, we could classify cough as acute or chronic. Acute cough are those cough with duration less than 3 weeks, whereas chronic cough are those cough with duration greater than 8 weeks. Subacute cough is given for a cough of duration intermediate between 3 weeks and 8 weeks. So based on timing, we can classify cough as nocturnal or daytime cough. Nocturnal cough means those cough which come specifically during sleep hours, whereas daytime cough are those cough which come specifically when the person is awake. We can classify cough also on the basis of secretion. So on the basis of secretion, we could classify cough as productive or wet cough and non-productive or dry cough. Let us listen to a few audio examples. Here, do you notice the person's cough? There is a background rumbling of something that is the secretion here. And that's due to the presence of that secretion, it is known as productive or wet cough. Here, after the cough, the person coughs out sputum. So, or any other kind of secretions. So that is known as productive or wet cough. Now let us listen to non-productive or dry cough. Here, you can note that there is the absence of that rumbling or secretory sound. So this is known as non-productive or dry cough. So continuing our classification, we can also classify cough based on character. So based on character, the cough is classified as barking or croupy cough, which are seen in laryngeal disorders, bovine cough, which are seen in the lesions affecting recurrent laryngeal nerve, and wheezing cough, which is seen in COPD or asthma. So let us listen to a few audio examples. So starting with barking or croupy cough. So this was an example of barking or croupy cough. Did you listen the background noise over here? The cough seemed as if some barking of a dog. So this is known as barking cough. And similarly, here it is known as croupy cough because these kind of cough are also seen during crop, which is laryngotracheal bronchitis. And now here you might also notice that there are bouts of cough. In between, there are pauses, which is inspiratory sound. And that inspiratory sound between the coughs is known as inspiratory stridor. We shall talk about stridor in upcoming videos. Now, moving on to the next type, that is bovine cough. Let us listen to the audio. Here, you can notice that the person is coughing, however, there is no power, or the cough sound is not seen properly, only the air is moving out. So that is known as bovine cough, and it is seen in lesions affecting recurrent laryngeal nerve. Let us make it clear here that recurrent laryngeal nerve is a branch of vagus which is found on along the sides of trachea and tracheoesophageal septum. Now talking about wheezing cough. Wheezing cough as seen in COPD and asthma. So do you notice here that there is pause between coughs? But unlike those seen in croppy cough, here the pause is expiratory in nature and it occurs between the single first cough and subsequent bouts of cough. So that is known as wheezing. And that kind of cough is known as wheezing cough, which is most commonly seen in COPD and asthma. Talking on types of cough based on character, continuing it can also be classified as brassy or metallic cough. Here, I do not have the audio for this kind of cough, but let me make you clear that in this kind of cough, the sound of cough is like someone is scratching a piece of metal with another piece of metal. So that's why it's known as metallic cough. And it is seen in tracheal and bronchial disorders, as well as in aortic aneurysms. Another kind of cough is painful cough, which is seen in tracheitis and left ventricular failure. The thing over here is that generally all the coughs, if coughed up for longer duration of time, will be painful. However, these kind of cough seen in tracheitis and left ventricular failure will be painful even on single or few bouts of cough. So classifying the cough based on voluntarity, it could be classified as voluntary, involuntary, and combination of both. Involuntary cough, coughing up or clearing the throat might be someone's habit, so that is habit cough, or it can be seen in awkward situation. Involuntary cough are due to any kind of pathologic causes or organic causes, and it could also be due to anxiety and psychogenic induction. Here, by the term psychogenic induction, I mean that the person might be suffering from some kind of mental disorders or might be simply anxious, due to which the organic causes, or let's say some diseases that lead to cough, are exacerbated, thereby the cough of the person starts on those awkward situations. So that is known as psychogenic induction, and it is involuntary. Whereas talking about combination of both, here I have told about combination of both because it resembles somewhat to voluntary as well as involuntary. So it occurs in an attempt to control an involuntary cough. So in the previous video, I had told to you about the 2 points which had clinical implication, and here I will clear it to you. The first point that I had told you there, that a deep inspiration before cough will increase the efficacy of cough reflex. Now the implication of that over here is that higher up the inciting stimulus is, greater will be the chance of deep inspiration before cough. That means if the cough inciting stimulus is in larynx as compared to bronchus or alveolus, then the chance of deep inspiration before cough is greater in larynx as compared to alveolus. So let us listen to the example of deep inspiration before cough. So now the second point yesterday was about multiple subsequent coughs leading to the cough stimulus generated towards the periphery. Here we can say that lower down the inciting stimulus, greater the chance of repetitive cough. That means if a person has repetitive cough which is going on and on, then we must consider that the cause for cough might be somewhere down in the airway. So let us see an example of multiple cough. So That means lower down the inciting stimulus, greater the chance of repetitive cough. And your last one and most important one is that all the chances of chronic cough at beginning will present as acute cough. That means we had classified the duration as less than 3 weeks and greater than 3 weeks, but any cause of chronic cough during its beginning will present as acute cough because if the person presents on the first week of cough, then it is acute, whether that be the chronic cause or acute cause. Now, let us talk about few general tips on cough. So here, again, I have kept these points in blue because these have some clinical implication which I will reveal on the coming videos. So for now, let us just understand that in virtually all the instances, evaluation of chronic cough merits a chest radiograph. So if a patient comes to you with a chronic cough, so then we have to order a chest radiograph. I shall tell you why in the upcoming videos. And another point over here is that cough also has circulatory consequences. So what are those circulatory consequences? We shall discuss in the upcoming video. So let us summarize this today's video. So we had talked about the type of cough and classified it on the basis of duration as acute or chronic, on the basis of timing as nocturnal or daytime, on the basis of secretion as productive or non-productive, and on various type on the basis of character and also on the basis of voluntarity. After that, we talked about two important clinical implications. That is, higher up the inciting stimulus, greater the chance of deep inspiration before cough. And the third point was lower down the inciting stimulus, greater the chance of repetitive cough. So this was what we talked about in this whole video. Hope you enjoyed it. Thank you